Good morning, this is Dr. Fletcher with your Monday Motivation. October is Breast Cancer Awareness Month. I think that we are all very aware of that statistic. Unfortunately, we have spent billions of dollars on marketing and research in cancer treatment, but we have spent very little on increasing awareness about prevention of breast cancer. And that's what we're going to talk a little bit about today. Breast cancer is a very common cancer, in fact, the second most common cancer in women, claiming over 41,000 lives a year and representing about 25% of all cancers in women. So it's very, very common and increasing, unfortunately, worldwide. Much of that is due to an increase in the risk factors, which I will talk about here briefly. Our purpose at Thrive and one of our main goals is to educate you and empower you to make lifestyle changes to have a positive impact on your health. So this goes true for men and women because we know men develop breast cancer as well. There have been studies done by the American Cancer Institute research which showed that by just making 3 key lifestyle changes, you can reduce your risk for developing breast cancer by about 30 to 50%. That's a significant number. And the top of these 3, I love top 10 lists, but the top 3 of these we'll talk about today. Number 1, incorporating and sticking to a whole food plant-based diet, loaded with lots of superfoods, as we call them, that can reduce your risk for breast cancer. That includes cruciferous vegetables, broccoli, cauliflower, walnuts, green tea, just to name a few. They are also high in a substance called indole-3 carbinol, which makes this whole process beneficial to you. More in detail on the handout that will be attached. The other 2 things, number 2, is to really obtain an optimal body weight. Increase fat really helps to produce more estrogen, and that will further increase your risk. So stay active and get your body fat down. That is a key thing to do. Don't accept midlife weight gain. We know that that is also a key risk factor for women. So weight gain in midlife with menopause will dramatically increase your risk. And finally, not to put the buzzkill on your week, but alcohol has definitely been determined to be a significant risk factor for breast cancer. You should reduce your alcohol consumption, especially women, to less than 4 drinks per week. Lots of studies done on this. So if you can adapt just those 3 lifestyle changes, you can make some dramatic impacts on reducing your risk for breast cancer. Please see the attached handout that we'll upload about this and several other lifestyle changes that you can make. I hope you have a good week and stay tuned for more info from Thrive. Bye.